New models show that Oregon's efforts to flatten the curve of COVID-19 just might be working.
Health officials cautiously optimistic the rate of infections has slowed, which would allow hospitals to withstand any spike of patients. Jennifer Dowling live tonight with more on what those health experts are saying. Jennifer?
Good evening, Jeff and Jennifer. Well, they're looking at a new model that shows that some of the social distancing measures can be incorporated into this model. And if the rate of infection goes up gradually instead of spiking straight up, as this model shows, then perhaps the medical community will be able to handle the number of patients that need care.
The state has been doing the modeling and predictions for Oregon. I think there's room for some optimism.
The Oregon Health Authority says new research models show that Oregon's quiet streets and warning signs are making a difference. Health officials say the stay-home order and social distancing may have put a big dent in the transmission rate of coronavirus.
They are one of our best tools for slowing the spread of this virus and avoiding a situation like we've seen unfold in Italy or New York right now.
Health officers say models from the Institute for Disease Modeling in Bellevue, Washington show that if people continue to follow these rules, Oregonians will not overwhelm hospital beds. This graph from OHA and IDM shows the impacts in more detail. If everything went back to business as usual, as indicated by the blue line, Oregon would need nearly 400 hospital beds by May 1st. If the order stayed in place and people comply as indicated in orange, Oregon would need less than 200. The green line shows that if transmission is reduced by another 30%, the state would need even less.
Our Institute for Disease Modeling really takes into account the picture on the ground here in Oregon, the measures we took in place, and gives us some confidence in what it says going forward.
Dr. Seidlinger says transmission appears to have been cut by as much as 50 to 70%. Although health officials are cautiously optimistic, Dr. Vines is still planning for the worst because of so many unknowns.
What if the picture is not as rosy as we think it is? Given that we think that there's been some benefit to the measures that we've put in place so far, what does a worst case scenario still look like?
And critics say that one thing that the model probably isn't taking into consideration is the fact that not everyone has been tested or can get to testing who has had coronavirus and maybe just had mild symptoms or no symptoms at all. Also, one thing that could affect this positive modeling that shows a gradual slowing of infection rates is the fact that healthcare workers might not be able to get access to PPE, that personal protective equipment in the future. Back to you in the studio.
And we certainly don't want to quit what we've been doing only to have something spike then again and have all that work go to waste. So that's something to keep in mind too.